Welcome to our channel, Hashmi Clinics.
All right, let's dive right into this clinical explainer. Today, we're looking at Ammonium Benzoicum, a really interesting remedy because it so perfectly bridges the gap between two major issues, a deep-seated gouty constitution and some pretty significant kidney problems. You know, this is a picture we see all the time in the clinic, and this remedy, it's a very specific key for a very specific lock. This quote right here, it just nails it. This is the whole essence of the remedy. We're not just looking at a case of gout, and we're not just looking at a case of albumin in the urine. We are looking for the patient where these two things collide. That combination, that's our big signpost. It's the absolute guiding principle for even thinking about ammonium benzoicum. So here's our game plan for today. We'll start with the big picture, the core idea. Then we'll zoom in on the patient themselves, explore the main clinical action, and finally, we'll get practical with how it stacks up against other remedies and some key takeaways for your practice. Okay, first things first, let's really get to the heart of what makes this remedy tick. That fundamental problem where a gouty tendency and kidney trouble meet.
You know, when we talk about a gouty diathesis, I want you to think way bigger than just a painful big toe. It's like a whole body metabolic traffic jam. The body just can't get rid of its uric acid properly. So yeah, it builds up as painful crystals in the joints, but that same stuff is also hammering the kidneys, gumming up the works of the body's main filtration plant. Ammonium benzoicum is aimed squarely at that systemic breakdown.
So who is this patient? Let's paint a picture. What are you going to see when they walk into your clinic? What do they look like? How do they feel? Let's build that clear clinical portrait.
Now this is huge. The head tells you so much of the story. We're talking about a profound heaviness, a real sluggishness. The old texts use the word stupid, and it fits. This isn't just being tired. This is a brain fog that comes directly from the kidneys failing to do their job. The toxins are building up, and you see it right here in their mental state.
And then you look at their face. See that? It's bloated, it's puffy, especially around the eyelids. Now that is not someone who just had a bad night's sleep. No way. That's your classic sign of fluid retention, a big red flag that the kidneys are really struggling to keep up.
And the urine, well, the urine gives the whole game away. There's not much of it. It's scanty, and it has this characteristic smoky, hazy appearance. It's like looking through a cloud. That's the albumin, the protein leaking out. It's a crystal clear, visual sign that the kidney's filtering system is breaking down.
Okay, now we're getting to the good stuff. Beyond the general picture, these are the weird and wonderful symptoms that make you say, aha, this is it. That swelling under the right side of the tongue, like a little cyst or ranula. I mean, how specific is that? It's a fantastic keynote. Or this one, a distinct pain right across the sacrum that comes with this sudden, gotta-go-now urge for a stool. These are the little gems that really lock in the prescription.
So let's zoom in now on the main battleground for this remedy. We're talking about the epicenter of the whole problem, the kidneys and the urinary system.
And you need to pay close attention to the right side. This remedy has a very strong affinity for the right kidney. The patient is going to tell you it's sore right there, especially if you press on it, or maybe even just from the pressure of leaning back in their chair. It's a super precise and incredibly valuable symptom.
So look, you have to put this whole urinary picture together. You've got the albumin confirmed, you've got the low volume, you have that signature smoky look, a really strong pungent smell, and thick gunk that settles at the bottom when it sits. When you see all of that, I mean, that's not just a hint. That is the body screaming that the kidneys are in serious distress. Okay, so where do we actually use this remedy? In what kind of clinical situation should ammonium benzoicum be at the top of our list?
It all makes perfect sense when you think about that core problem, right? We use it for gout, of course, especially with those deposits in the small joints, for albuminuria, but specifically in this type of bloated, foggy patient, for rheumatic pains that just wander around, for general swelling or dropsy that's coming from the kidneys. And here's an interesting one, urinary incontinence in older folks. But, and this is the key, only if that whole gouty kidney backdrop is there. It always comes back to that central theme.
Now this is where good prescribing really happens. We have to know how to tell this remedy apart from its lookalikes. This is absolutely critical for getting it right, so let's break down a few key comparisons. Okay, first up, benzoic acid. Everyone thinks of it for gout, right? But here's the clear difference. Ammonium benz is your heavy, dull, mentally foggy patient with that smoky, albuminous urine. Benzoic acid, totally different vibe. They're more anxious, more restless, and their urine, wow. The key feature is the smell. It is intensely offensive, almost like a horse's urine. For benzoic acid, that odor is the undisputed star of the show.
So what about terebinthina? Well, again, it all comes down to the urine. It's the dead giveaway. Remember, ammonium benz is smoky and has albumin in it. Terebinthina is straight up bloody, it's hemorrhagic urine, sometimes with a strange odor of violets. Plus, the pain with terebinthina is way more intense. We're talking violent, burning, drawing pains on the kidneys. It's a much more acute and violent picture.
And here are just a few others to keep in your back pocket to really sharpen your analysis. If albuminaria is the main thing you're seeing, well, then you have to think about remedies like Kalmia, Helionis, or even Cantharis. If the gouty deposits themselves, the concretions, are the biggest problem, you might want to take a look at guanethyllium. And for that specific combo of urinary incontinence and rheumatic pains, you definitely want to compare it with causticum.
Okay, let's put this all together. How do we make this easy to remember and actually use in the clinic? Let's talk prescribing pearls.
I want you to think of this as your 4-point checklist for a confident ammonium benzoicum prescription. Step 1. Do you have the gouty background? Check. Step 2. Are the kidney signs there? That smoky, albuminous urine? Check. Step 3. Is the patient mentally heavy and dull? Check. And finally, step 4. Do you have a weird, peculiar keynote to seal the deal, like that sore right kidney or the swelling under the tongue? Check. If you can tick those 4 boxes, you are golden.
Seriously, if you walk away with just one thing today, let it be this sentence. Burn this into your brain. The bloated, stupid, gouty patient with smoky, albuminous urine and a sore right kidney. That's it. That's the whole remedy right there in a nutshell.
So I'll leave you with this question to think about. This is a powerful remedy, but I think it's probably underutilized. So the next time you have one of those really tough cases, a gouty patient, kidneys are clearly in trouble, and the usual remedies aren't quite working, I want you to just stop and ask yourself, am I seeing the full picture here? Because maybe, just maybe, ammonium benzoicum is the precise key you've been looking for to finally unlock that case.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.